There's a divide in this country. It's between the haves and the have-nots. Money, education, gender, age, race, they all have something to do with it. But I'm talking about the divide between the people who'll live long and healthy lives and those who won't.
Psychology in a traditional way is crucial, but not everybody can get it when they need it all the time. And even more, many people don't even try to get it.
They're not allowed to eat the same meals or eat well or eat enough. Many of the domestic workers that I've worked with have developed very serious physical problems.
But I kept saying, I don't know what's wrong. It's not any one thing. I'm in really deep pain. I can't keep living like this. And he just asked me if I could come back in 2 weeks.
I'm Dr. Celine Gounder, and I've spent much of my career serving communities who struggle to be seen, to be heard, and to access the healthcare they need. Because poor health, it isn't random.
So we got this call that it looks like blank is flowing into the stream, into the St. Johns River, and we said, maybe an environmental violation we have here.
I'm going to blow the line here, but they say something like, let's either switch or die. And if you can't get switched, you might as well commit suicide.
There are barriers to health you've never considered, and there are stories you've never heard.
It was the addiction that led her to be so vulnerable to being trafficked.
I think we're pushing them too hard. I think that they don't get any breaks. In my son's case, he didn't get a break. He didn't get time to be a kid.
For any transplant, you have to be evaluated from head to toe, not just physically, but also psychologically and financially. And she couldn't get through those hoops.
This is the podcast that asks what exactly is getting in the way of health for millions of people. Because it isn't just about politicians arguing in Washington. It's about who you are, where you live, who your family is, and your employer. It's about your grades in high school, your Facebook page, the movies you watch, the people you love, and who listens to you. Join me as we ask the questions that most doctors won't, to try to understand who gets to be healthy, who doesn't, and what we can do about it. I'm Dr. Celine Gounder. This is In Sickness and in Health.